down, brother. I know you have gynecomastia issues. What is your relationship with sports like?
I don't even feel the desire to do it. That's why I want to get rid of it.
You haven't had surgery before. Let's examine you now. I will sit down because I am an old doctor. Come on, I kindly ask you to take off your t-shirt. Can you take a step back? You can leave your t-shirt this way. When we examine gynecomastia and conduct our checkup after the surgery, we will maintain a position by tensing our eye muscles. Show me your pecs. The tissue between the chest muscles and the skin is what we call our target tissue, which is gynecomastia.
There's a gynecomastia issue here with glandular tissue. Let's go over it.
Feel free to relax. You may have looked up my technique online, but let me explain it to you. I make cuts from here and here. Normally, the Gynecomastia book provides information in this field, but it covers a broader area. We will work on it. Why? So that we can shape the chest cage as we desire. We will take out most of the fat tissue between the muscle and skin in this area, along with the whole milk gland. When the procedure is finished, you will feel the muscle directly when you touch it by tensing up. The surgery is done. It takes about 40 to 45 minutes. We will close the cuts with stitches that dissolve by themselves. No stitch removal will be necessary. We will not use resistance at 99.9%. After that, we will wake you up and put a corset on you, then we will take you to your room. You can get dressed. You will be our guest in the hospital for about 3 to 4 hours. Following that, you will be fit for discharge. Our first checkup is scheduled for 2 days from now. After we finish this initial checkup, you will be allowed to take a bath. In 2 weeks, we will check on you again. If all is well, we will finish the corset usage. There is a slight chance we may recommend extending the corset usage for another week. The operation isn't painful. You might feel a few small pains, but there won't be any major pain problems. In the first 2 days, the corset will be quite snug. We will put a towel inside, referred to as an underpad, to help lower the risk of hematoma. By the second day, once we take out that towel, you will find yourself much more at ease. Your arm movements will be limited. What do I mean by that? When you try to raise your arm, this chest muscle will pull you back down. You will commence stretching exercises from day 2. In 1 to 10 days, we will recover all arm movement abilities through stretching and physical culture exercises. After 2 weeks, you will start exercising. What do I mean? Weight training with light weights. Gradually, you will elevate your workout intensity. In a month, you will be allowed to swim in the pool or sea. In 1.5 to 2 months, you will be capable of training at a level suitable for the Olympics. The risk of complications from the surgery is very low, but it does exist. What risks might we encounter? The scar from your incision appears reddish in the early stages. After 2 to 3 months, it begins to fade. Within 9 months to a year, it will reach 90% of your skin color and become barely noticeable. Although the chance of complications is only 2 to 3%, it still exists. It's important to ensure that checks are not overlooked. If we notice a bad direction, we can come up with extra solutions. This cigarette. The use of cigarettes can sometimes hinder the healing of wounds because it adversely affects blood circulation. There's a 99.9% chance we won't face any issues, but it's quite rare. I've had 1 to 2 diseases among almost 1,700. Smoking leads to problems in healing wounds and affects circulation. Cut down as much as possible. If you can, just stop, don't drink. It's bad for your health. In the beginning, you may see hematoma, and later on, seroma. What is the Turkish translation? A hematoma at the surgical site means there is bleeding, which leads to blood accumulation. A seroma, on the other hand, means there is an accumulation of serum fluid. Both are rarely encountered. The final result will not be negatively affected. However, you need to come to us 4 to 5 more times. Why? To be able to drain the accumulated blood or fluid with a syringe. Let's say we had surgery. We did the operation. Before releasing, we checked. There's a hematoma, so we might need to take out the surgery and drain it. But this is a much rarer condition. As a matter of principle, I am doing my best to explain everything to my patients. This area will experience numbness in the skin. This sluggishness will gradually pass over weeks and months. You will be in a state where you can feel yourself with over 90% clarity. However, patience is required for this. Recovery requires patience. Will there be sagging in the skin? Will there be folding in the skin? I think there's a 99.9% chance you won't. Still, after the surgery, your posture will be like a tough guy. Shoulders back, yes, shoulders back. I will stand as if I am the toughest, the most resilient person from your hometown. You will have a tough posture. The second measure is stretching exercises. We will perform these stretching exercises hundreds of times daily. The third step is to begin exercising in 2 weeks. Even if you don't go to a professional gym, doing Pilates band exercises, resistance band movements, and push-ups at home will be enough for us. If you head to the gym, you'll feel much better overall.
Can I do push-ups?
You can do push-ups. After 10 days and a week of practice, you will be able to do normal push-ups at the wall or table edge in the second week. And our fourth measure is patience. Visual wound healing appears to be completed within 2 to 3 months. However, at the cellular level, it continues for 1 to 1.5 years at a microscopic level. For this reason, we will continue our follow-ups and checks for a year. As I said, I don't think we will see sagging or folding in the skin 99% of the time. But still, let's adhere to these precautions. Is there anything bothering you? Don't worry, there are no questions. I just want to recover. I hope we will be successful. I don't ask for anything more. Thanks, brother. Sports are vital. They are the main problem. So, let's begin our surgical preparations. Friends, please explain the details to him. They will cover the non-medical aspects. If all goes well, we will meet at the hospital. You have the medical information. Yes, I have the medical details too. patient's drawings and examination, and now we will start the surgery. We will carry out the procedure using the technique we always apply. There is a gynecomastia issue with fat tissue and milk gland. We will perform liposuction to take out the fat tissue. Then we will end the surgery by taking out the milk glands from the same cut. If everything goes well, we plan to release our patient in about 3 hours. There will be no need for them to remain in the hospital. In essence, we will persist in delivering information to you in this manner. Hello, friends. We have now completed our surgery. Our patient had a moderate level gynecomastia problem. Therefore, we performed a little more than 1 liter of liposuction. At the same time, we are also removing the breast glands from the incision where we did the liposuction. In a volumetric sense, mammary glands cannot be melted or mechanically broken down by lasers or any other devices. When we do not remove it as a mass in terms of volume from there, liposuction alone is often insufficient to solve the gynecomastia problem. Thus, we performed liposuction and removed the breast glands. Right now. The nurses I work with are currently covering the patient's skin. After that, we will help them put on the corset. Finally, we will escort our patient to their room. This is how we will begin the healing process. Make sure to look after yourself well, and I hope to see you again shortly. Has it really been 2 weeks already? Let's see what's going on. I need to check the date for the surgery. Hopefully, if there isn't any fluid buildup, we can rescue the corset today. The seroma is extending the corset's usage. If there's no seroma, we can free you from the corset.
Hopefully, there isn't any.
You can leave it like this. Let's place your coat like this. Let's check a chest muscle. This is our way of objective assessment. Come on, sit down like this. Let's check for any fluid accumulation with a needle. But you look very good, mashallah.
How are you doing?
In general, I didn't really feel much at all. Everything went pretty well, actually.
Starting today, we will begin using the scar cream. How will you use the scar cream? You will take an amount the size of a lentil on your fingertip. You will use it by pressing and massaging for about 30 seconds on this area. Let me tell you a funny story. One day a patient from Trabzon came and I was explaining this cream. I said to use it by pressing like this. The patient said, "Doctor, should I apply the cream here first and then there?"
That's awesome.
You apply the cream here. You press it in like this for 30 seconds. Look, these crusts come out like this. Sometimes these scare patients. Let me clean this up without you asking.
See, the usual color is coming out at the bottom. It also appears at the nipple. Sometimes we notice crusts like this. There's a little bit of it here too.
The chance of losing tissue due to its depth is very, very rare. I've treated 1,700 patients. I've had 1 or 2 come to me. We're trying to figure that out too.
Professor, the color looks quite terrible at this moment. Should we consider not removing it?
It will be normal. I will cream here. It doesn't seem like you only have 1 or 2. Still, let's check it out.
While we are holding it, it seems to be much larger. But when we take it out, it diminishes greatly.
Now keep doing the arm movements, the stretching exercises I demonstrated. Additionally, you are commencing weight training. Start off with lighter weights, particularly those that are appropriate for girls. Using resistance bands for opening and closing movements, which means you will exercise your chest muscles. You will do push-ups using your body weight against the wall or at the sink. For now, we'll start with these. Slowly, we'll increase the tempo of the exercise. You can swim after a month. Swim after a... The issue is that you wanted to swim in the pool and the sea. In a month and a half to 2 months, you will be ready to prepare for the Olympics by pushing yourself. You began today with a light effort. You are gradually increasing your intensity. There is no sudden quick progress. He will always climb the stairs slowly. You keep wearing the corset today and tomorrow. Completing the 2nd week means we are free from the corset. We maintain the kabadai pose. This will now reflect your lifestyle, body style, and fashion. To that skeletal structure. Get used to the tough stance. Now, go ahead and get dressed. I don't let water through, right, teacher?
Aren't these stitches supposed to be waterproof, right, teacher?
Letting water